Hi guys, are you somebody who's struggling with knee pain? Giving you a few tips to rise. For rest, icing, compression, for elevation. Just follow the instruction. Technique is known as cryotherapy. Icing, elevation with pressure, ointments and gels. You can also try herbal supplements. I hope this was useful. Hi guys, are you somebody who's struggling with knee pain during this pandemic time and you do not know what to do because you're unable to get in touch with the medical personnel who you need to contact? I am Dr. Santosh Jacob, orthopedic surgeon and sports injury management specialist from the city of Chennai, Tamil Nadu, India. And I will be giving you a few tips which I think have helped a lot of my patients who are struggling with very similar problems during these extraordinary times. So, you could belong to either of these four categories. One, you had planned a surgery during this period and you were unable to go through with it and you do not know how long it will take. Two, you have just had a surgery before the pandemic started and now follow-up and physiotherapy is a bit of an issue. Three, you're somebody who has osteoarthritis or rheumatoid arthritis, some degenerative issue which has been troubling you for a very long time. You didn't do anything about it, but now the pain is increasing and you're not sure what to do. Four, you could be somebody who got injured during this period and you're just recuperating. Now, all the techniques, all the methods which I'm going to tell you will benefit each and every one in this category. So let's get straight into it. My first point would always be RICE. R stands for rest, I stands for icing, C stands for compression, and E stands for elevation. When it comes to the knee, when I say rest the joint, not your entire body. If you have a problem in the knee or if you've had a surgery in the knee, you have to rest the joint by not moving it too much and not applying weight on the joint if your surgeon has said so. But you are allowed to move on the walker, and if you have been told to not bear weight and you're allowed to move with the walker, but just follow the instructions of if you have been told to not bear weight, do not bear weight on the joint, and if you have been told not to move the joint, do not move the joint. But to move around even when you're recuperating is very important because it increases your blood circulation in the area. Icing. So you know that you can apply ice and when it chills down, the pain reduces. There is another reason how icing improves. We are warm-blooded animals. When we apply ice, what automatically happens is our body temperature in that area reduces and immediately blood senses that one area is becoming cold and warm blood flows to that area to reduce or equalize the temperature. What happens is circulation of blood increases healing, circulation of blood reduces your pain, and this is how icing helps. So in the same concept, now you probably understand that you can ice and also you can apply warmth because an alteration in the temperature will increase your blood flow, thus reducing your pain and also improving your healing. C stands for compression. So if you're injured or you have pain, using a crepe bandage to bandage the area in a tight, firm manner is very good as it gives you some support in the area. If you're having osteoarthritis, you can even use an osteoarthritis brace. Evidence shows that there is some amount of realignment and this realignment helps in reducing the pain. Now, there are a few things to be cautious about when you are using a knee cap. You should be cautious that it is not too tight and it is not compressing blood flow to the lower part of the limb. So if your feet are hurting and your calves are hurting, it means that it is too tight. Sometimes even swelling of the leg is there. There is a simple way in order for you to see if it is too tight or not. When you're sitting on a chair, you should not have any pain in the knee because of a compression around the knee, which sometimes comes with a crepe bandage which is tied too tight, and then you have to release it, otherwise it will cause compression symptoms in the lower part of the leg. E, elevation. The knee can be elevated at the foot by 2 pillows when you sleep. If you have any swelling in the knee because of activity the previous day, application of ice packs, that is Never apply ice directly to the skin because it can cause burns in the skin too. Always wrap it up in cloth or in a turkey towel and apply it on your feet when there is swelling. Along when elevation and ice are applied together, swelling and inflammation in the region reduce faster. This technique is known as cryotherapy, icing elevation with pressure. It is being used in sports medicine to treat a lot of diseases, especially reduce inflammation due to trauma or injury. Third, ointments and gels. There are three kinds of ointments. First one is counter irritants, which irritate your skin and make you feel that your pain is less. Then you have ointments which either make your skin cold or make your skin warm. Generally, the ointments which make it cold have menthol. And if you see the term therma gel or heat gel, it means that it is going to warm it up. I advise my patients to alternate both, as it gives a better chance of circulation increasing and your skin also will not get irritated or burnt. And also a word of caution, if you're applying a lot of ointments, the kneecap or the crepe bandage should not be tied too hard because they need to breathe, otherwise again you can have friction burns. 4. Medication and exercise. Exercise without moving the injured joint or the operated joint can be done. Exercises are of two types. One is isometric exercises where you keep the length of the muscle the same. What I mean is you do not have to move a joint in order to contract a muscle. When you have pain, a good way to exercise to activate the joint which is painful is to keep the joint without moving but tighten the muscles which move the joint. This is known as isometric contraction. This can be very easily done. I am going to show you a simple example with my finger. So if you see my finger, I can exercise my finger by moving my finger throughout the range of motion. Or with my mind, I can concentrate and tighten the muscles of my finger without actually moving the joint. So the second one is called isometric. And if you have a pain in the joint, a way to still activate your muscles would be by isometric tightening, where you keep the joint at a position where you have no pain and you just tighten the muscles which are around the joint. Try it, it gives very good benefit. Apart from that, when you do exercise all the other joints without the joint involved, because any kind of exercise increases your serotonin. When your serotonin increases, automatically endorphins increase. Endorphins are our body's natural painkillers. You will definitely feel a reduction of pain. So I suggest that even if you're immobile and one joint you're unable to exercise, that you move and exercise the rest of your body so that you get your dose of serotonin and endorphin. Medication, do not change any essential medication. Do not increase or reduce your painkillers. Always call your doctor, consult, and then change any medications. You can also try herbal supplements like Cissus quadrangularis, which is very good for joint pain, and kurkumin also. As you know, kurkumin is an active ingredient of turmeric and is quite easily available. And if you're somebody who's struggling with pain in spite of all these, I suggest you talk to your doctor about PRP or platelet-rich plasma injections. These are a natural way where we take your blood and concentrate the healing factors and growth factors, basically the anti-inflammatory substances or molecules which are in our blood, and we inject it into inflamed or degenerated areas. The advantage is it is your own blood product, so the complications are very few. Second, it is bactericidal, so the possibilities of infection are also less. A PRP injection could be quite a safe way with which you can reduce your knee pain if none of the other methods I advised are working for you. So please talk to your orthopedic surgeon about it and do something about your pain and reduce overall inflammation in the body. It helps with your immune system getting stronger. I hope this was useful. Thank you guys.